the same. It's that affirmative therapy approach. Everything is affirm, affirm, affirm. And so when I first started hearing this, I would challenge them. Really, I would step outside of transgender, and I would just focus on a profound mental illness like bipolar with psychotic features or schizophrenia with psychotic features. And if you hear somebody talking about, for example, many years ago, I had a client that believed the TV was telling him to do certain things. And so he was having active psychosis, and it was with the diagnosis of schizophrenia. And so he engaged in what the TV he believed was telling him to do, and he was missing for about a week. And long story short, they found him barefoot in downtown Houston and all the things. So if I have a client like this sitting in my office and I affirm what he is believing to hear, whether it's from the TV or voices, wherever, if I affirm this, what's going to happen? Because what if it's telling the person to kill somebody? So why would we affirm? And everybody agrees, you don't affirm, you don't affirm. But then also, you can't just argue it. I can't say, you're not hearing that, because that session's going to turn into a battle back and forth of who's right and wrong. And who am I to say he's not hearing those voices? And so instead, we have to explore what's going on and use logic to process through all of this. And the counselors are engaged in these great conversations. And then at the end, I say, okay, now I'm going to shift topics just a little bit. Same idea on how to treat this, but you have an 8-year-old coming into your office that's a boy claiming to be a girl with a self-diagnosis of transgender, a trans woman or trans girl. And how do you manage that? And really what I found, even though the educational institutions are pushing this ideology with affirmative therapy, the counselors at my practice were unsure of how to respond to that. And they were very uncomfortable because they knew that there was a conflict there. They just didn't know how to breach that information. So I really work with them to get comfortable with this topic because it's going to be more and more prevalent as the years pass.